food services and food safety. It's on page number 87. Those who have the textbook, it's on page number 87. So, food services. If the food is inappropriately stored, okay, and if it is not prepared well, it can definitely lead to illnesses such as food poisoning, food infections, etc. Okay, so food illnesses could be particularly dangerous, even life-threatening to hospitalized patient who is already immunocompromised. Okay, whose condition is already compromised, and on top of that, you are giving them bad food. It will lead them to further complications. It will not help them to recuperate. Okay. So safe food storage may include the following principles such as first in and first out, which helps ensure that the food is used before it expires. Okay. First in, first out means FIFO. Okay. And the abbreviation of FIFO stands for first in, first out. It means the food which came in first. It could be vegetables, pulses, whatever food items were used in the hospital, which was bought first, should be the first one that should be utilized. Okay, things that are bought later will be utilized later. So first thing which you had bought is the first thing that you store, and it is the first thing that you use also. That's the FIFO strategy in which we use in food services. So coming to the qualification of a food safety officer or a quality coordinator, if you do not have a food safety officer, quality coordinator can also be responsible for the below task. Okay. Implementing food safety requirements to make sure that you are compliant with the food standards of the nation, of the region which you are working for. Every nation has certain food compliances every day. For example, in India, FSSAI that uses the food compliances, that makes the food guidelines and principles. That is what we generally use. Okay, so food compliances and food standards given by public organizations that has to be put into practice. Okay, so that implementation is the duty of food quality or food and safety officer. Monitoring and managing compliance with its directive and this guidelines. Okay, make sure that everyone is following the compliance. For example, wearing personal protective equipment while on food duty. Okay, while in kitchen or not smoking in kitchen. Okay, but are the staffs following these compliances? That one has to monitor on a daily basis. You have to monitor certain gaps will be there in fulfilling the objectives. So you have to manage that as well. Okay. Investigating complaints. Whatever food complaints maybe the staff has also given to you, or the patient complaints or the customer complaints that you have received, you have to do the investigation. Why did the maybe they have received a stale food. Okay, it was cooked properly, but by the time it was supposed to be served, it became stale. Why did it go stale? Okay, was it stored properly? Didn't the officers do a taste test, etc.? Okay, so these kind of investigations you have to do on a daily basis. You will be receiving some or the other complaints from the customers, consumers, as well as the inpatients. Okay, you have to make sure that the suggestions and the feedbacks reaches to your ears. It's not hidden. Providing for adequate design, construction, and maintenance for food service facilities. There is a specific areas which are preferred to be converted into dietary department or the kitchen department. And if it is a kitchen department, there is a specific constructions that goes on so that there is no gas leakage. There is minimal occurrences of hazards, safety hazards. Okay, considering all these factors, a specific construction is done for a healthcare, that's dietary department or kitchen department. Okay, those kind of blueprints has to be put into practice as well. Provide staff training, specifically when it comes to infection control, food safety, okay, techniques, and safety hazard, fire hazard. Okay, there are n number of topics that can be trained. Even if the staff is already trained, retraining has to be ensured when you are hiring new staff for the kitchen department. They also have to undergo the same training, same induction, and then they are put into work. Identifying symptoms, identifying infectious symptoms among colleagues are also being trained in the kitchen staff. Then you have to provide for adequate food labeling. Food labeling ensures that people who are allergic to specific kind of food, okay, those information is not masked. Okay, food labeling is important so that people who have allergies, people who have some contraindications, etc., they can make sure that they are having the right food. Okay, this food is not going to cause more harm to them. And food labeling will also have the date of expiration as well, so that is also important to be noticed. So nominating food safety officers, sorry, nominating food safety supervisors. Food safety officer may just do the general evaluation, but food safety supervisors are the ones who are usually 24/7 present in the dietary department, supervising the things, monitoring that everything is compliant or not. If there is any gap in the implementation, it has to be brought to the notice of the food safety officer. Okay, so food safety supervisors are usually subordinates to the food safety officer for that particular program. Developing and reviewing food safety programs. Every year, there will be some changes in annually, some changes will come into the food safety programs. For example, um, new allergens or new preservatives which are taken out of it is considered as toxic, bad for health. Now you have to stop using this kind of preservatives. Specific brands has to be stopped. For example, in between, Maggie was banned. Okay, so even in the college canteens, in the hospital canteens, everywhere where Maggie was used, it had to be banned. So these kind of changes, sudden changes may take place, and your food safety manual, food safety program should be prepared for the change. Okay, so every year expect some or the other change to your ongoing food safety programs based on the legal changes or from the FSSAI, what research they have done, research based changes, evidence based medical changes, some changes you may have to bring into your food safety program. Implementing and complying with accredited food safety program. For example, just like how hospitals get NABH accreditation, JC accreditation, similar way, a kitchen department or the dietary department or canteen of a hospital can also go for FSSAI certification. Okay, there are accreditation programs and certification programs which establishes profound quality implications on the dietary department that you can go for if you are pretty sure about the good quality of food safety programs that has been followed in your canteen or followed in your dietary department. You can definitely go and try to achieve these certifications as well. Okay. Arranging for audits, internal as well as external audits. When it comes to auditing, if you are doing regular internal audit, you do not have to worry about a surprise food safety or inspection visit from the healthcare authorities. Taking action to remedy compliance as soon as possible, not delay it. Okay. Any non-compliances seen in the kitchen and dietary department, measures to rectify it has to be taken immediately. Next, coming to the class categories and requirements. Okay, classes. These are the classes of canteens, we can say loosely, okay? Or the food department in a hospital can be loosely classified into these three segments: class 1, class 2, and class 3. We'll see each one in detail. So in class 1, whole fruit, vegetable, tea, coffee, juice, milk, any confectionaries, chips, nuts, packaged items. Okay, usually everything that is packaged, nothing is made here. Okay, even the tea or coffee that is available, it's usually in the form of it is made and it is made already pre-prepared tea and coffee. It is made already and it is sold from these stalls. Okay, biscuits, slices of cake. Okay, these are the foods that are not hazardous. They are not prepared here. Okay, class one food stall or food department does not have the enough materials to prepare elaborate food or snacks here. Okay, they just sell those things that are available in ready-made packaging. Already packaged, pre-packaged food is sold from the class one stalls. Every food that is packaged will be sold in the class one stalls. So the class one food service facilities, they will not be subject to any routine or external supervision or monitoring. Okay, they are considered as low risk. Okay, because everything is already pre-packed, it is not prepared here. So risk of transmission of infection is pretty low in class one food service facilities. Okay, but still they have to meet their fundamental responsibilities in relation to handling and selling safe and suitable food. For example, they are not supposed to sell expired food. Okay, they can voluntarily comply with the requirements of class 2 and class 3. We will see class 2 and class 3 later. What are the examples here? They can also appoint a food safety supervisor. It's not compulsory, but they can still apply for a food safety supervisor. And the main thing what they have to make sure here is nothing expired or unsafe products should not be sold from the class 1 food service facility. Then we have the class 2 food service facilities. It also provides all the packaged food items, but along with that, unpackaged food items are also sold to the patients, staff, public, etc. And packaged food as well as unpacked food is given here. They also possess a sufficient risk of infections, so they have to undergo routine supervision as well as monitoring. Okay, and they have to ensure that the food safety premises are constructed and maintained properly to comply with food safety standards. The food is labeled accordingly. Okay, ingredients are listed, proper labeling is given, expiration date is mentioned on the food labels as well. You have to submit plans for any, if you are doing any renovation or refurbishing the food stalls, you have to submit the plan, get the approval, okay, from the department, and only after that you can proceed with the construction and renovation here. Okay? And ensure that the food is properly labeled according to the food standards code, and at least one food safety officer is compulsory here, and you have to notify the Department of Food Safety also regarding who is your food safety supervisor. The contact details of the food safety supervisor should be submitted to the Department of Food Safety. Next, coming to the class 3 food safety facility. Okay. So here the class 3 facilities, they provide cooked meals. Okay, basically they provide cooked meals to the patient as well. 6 or more inpatients are available in your hospital or facility, and if those patients are receiving food from your food department, definitely you come under a class 3 food service facility. So, if any potentially hazardous food is given to 6 or more patients in a hospital, it's a class 3 facility. Even if it is a day hospital, daycare center, and 6 or more patients are receiving food from this facility, it automatically transfers into class 3 facility to residents or aged people, children as well. Okay. In every age group or category, 6 or more is a number. If 6 or more people are getting their food requirements met from this food service, it is a class 3 food service facility. Ready to eat food is also available here, along with potentially hazardous food, and it is delivered by the hospital staff, or organization will deliver the meal to the patients who are in bed. And class 3 food facilities can either be off-site catering or on-site catering. Off-site catering means, for example, Akshay Patra. Okay, Akshay Patra is an example of an off-site catering. They prepare their food in one particular area. They travel with their food and it is distributed to other areas. Okay, hospitals, schools at the midday meal program and all. Okay, so Akshay Patra is an example of off-site catering. On-site catering means hospital within its own premises has a dietary department where food is prepared. That is on-site catering. Okay, and definitely they pose a sufficient risk and they require much higher level of supervision and monitoring. On a daily basis, checklist is done in the kitchen department. On a daily basis, food inspection will be carried out. They will have definitely more than one food safety officer as well as supervisor, because definitely they have a higher risk and potential to transfer infectious diseases. Again, here, any plan for new renovation or refurbishment has to be submitted to the department, get the approval, and only then you can do the renovation. Next, coming to the food safety program. Okay, general coverage of what all should come under a food safety program. So this food safety program can undergo changes over a period of time based on the researches, medical researches on nutrition and clinical nutrition researches that have been conducted over a period of time. Okay, those researches, those evidence-based medical practices could bring about annual changes in the food safety program. Okay, so it has to be modifiable as well. So all the class 3 food service facilities which we have discussed previously, they are required to have an accredited food safety program in accordance with this guideline. Okay, you can take any accredited food safety program from FSSAI or any uh, equivalent institution. Okay, every institution, every food department institution have their own food safety program. So you can take assistance from that as well. So a food safety program must systematically identify all the food safety hazards. Okay, which can reasonably occur in food handling operations in the food service facility, from the time of procuring the food to the time of delivering the food or meal to your patient. That is an entire operation. Okay, anything can go wrong at any point of time. Okay, so from the time of procuring the food till the time it is served to a patient. Okay, everything has to be detailed. Every potential hazard has to be identified. Okay, list the steps that are used to produce the food in the facility in a progressive sequence, that the receipt from the food until the final step of the service, everything should be traced out, and all the potential hazards that can take place at each of these steps should also be listed out. Okay, authorities should have an idea where things can actually go wrong and be prepared with the solution. Okay, you have to identify where in the handling operation hazard can occur. Okay, now you have made all the step by step procedures. Now you have to identify in which food handling step what kind of hazards can come. Okay, for example, those who have the textbook, if you check on page number 92 and 93, there is a table, a hazard support program table. Okay, different kind of hazards, uh, uh, what kind of program you have to look out for to nullify the hazard. Okay, for example, um, any microbiological, physical, or chemical hazard that comes with the food packaging or food material. Okay, how can you avoid it? The answer is you go to a supplier which you are sure of that they sell only organic stuff. They do not use they will not sell you fruits and vegetables which is highly glazed with pesticides or fertilizers. They are selling you the most natural and organic food produces. So choosing the supplier becomes the correct action to tackle the problem of toxic substances that comes with your food packaging. Okay, so that is the solution. Next is any hazards that rise from the staff who is handling unpackaged food. That is during the time of cooking, cutting, washing the food. mixing the food, making the recipe. Okay, these all are the activities in which the food handlers are in touch with unpacked food. Okay, so definitely, how can you tackle the issues that arises here? Make sure the staff who is handling the unpacked food, they have a proper health and they practice good hygiene. Okay, their hygiene and health should be completely perfect. Only then they are allowed to handle unpacked food. If you have any pest infestation, rats, cockroaches, or any other pest roaming around in the kitchen or dietary department, you have to definitely call for the pest control. If any equipment in the premises, okay, if any mechanical or chemical issues turn up with the equipments used in the kitchen or dietary department, make sure that it is cleaned properly, sanitation is maintained properly for these equipments and machinery. Okay, proper maintenance is done, preventive maintenance, predictive maintenance is done on time, so that your kitchen appliances are always in a working condition. Then storage and the use of chemicals in the kitchen department should be kept completely away from the food preparation area to avoid any poisoning causes. So these are the different hazards which we have identified in a just pointing out certain hazards which you can identify in a kitchen department and how you can tackle those issues. Okay. The third point is provide for a systemic monitoring means of control. Okay, in which questions like who is the person who will do the monitoring? Is the supervisor responsible or the officer or a quality control coordinator is responsible? You have to make sure who is responsible for day-to-day monitoring, weekly monitoring, monthly, quarterly monitoring, who is responsible. Okay, these controls has to be listed down. Making sure that documentation is done properly. Whoever is doing the monitoring, even if it is daily basis, it is documented. Every day's documentation is done properly. Okay, what has to be monitored? Which area has to be monitored? How will the monitoring go? Will you use checklist? Will you use user observation? Will you use any devices to understand if it is in the normal rate or not? Who is the person responsible for the monitoring? And at what time of the day monitoring should be done? Is it twice a day, thrice a day, or morning, evening? When is the time these checking and inspection and monitoring should be done? All these questions has to be answered in the third point. Okay. Provide for appropriate corrective action when hazard is found to be not under control. Corrective action, CAPA. You can follow corrective action and preventive action. Sometimes some specific cause errors can take place, special cause errors can take place. You were not prepared for it. Okay. Hazard can occur anywhere, anyhow. Any sentinel event can happen in the dietary department as well. So a corrective action should be taken within that day itself. Okay. Corrective action generally has two stages. Firstly, immediate action has to be taken so that the food does not become unsafe. Okay, you can salvage as much of food as possible. Food does not becomes unsafe, and the hazard, and even if the hazard is not under control, then in the second step you will go for investigation. How did you lose control here? Okay, what was the root cause which led to this hazard in the first place? That is the second phase of the investigation. First phase, you have to find the immediate solution so that food is not destroyed. Okay, as much as possible, food can be saved and it can be given to the patient. Which part of the dietary department has been affected? Only the food prepared from that part will not be used for that particular day. Okay, so immediate action requires salvaging as much as food possible. Don't completely waste all the food. Salvage as much of safe food possible for the patients. Remaining should be notified the authorities and immediate action to investigate should be rolled out. Provide for regular review of the program by the food service facility to make sure that it is appropriate. This is where annual changes in the food safety program comes into play. Even though you have selected your food safety program from the best sources, you cannot be always sure about it. You may have to address your food safety program correctly if all the guidelines are appropriate to this day and time, because if you take up the food safety programs from 10 decades or a decade back, it will not apply for today's generation. Okay, every year some changes is coming up. So is your organization apt enough to use the most modern technologies of food safety? Does it have the capacity to use the most modern technologies of food safety? Okay, so this regular review will be done on a annual basis, at least on an annual basis. Review has to be done. Your food safety program should be submitted to authorized organizations like FSSAI or any other organization who are well qualified in food safety, especially healthcare food safety. They will review your program. If they find any changes, wherever you can make some changes, they will give you the errors, and you will have to submit the program again after rectifying all the errors. And once they approve it, you can put it into practice in your title department. So food safety program in general, they have a food safety plan. Monitoring will be done on a regular basis. Verification is done. What you're doing, is it correct or not? Okay, that is a verification. So you will have a plan. You have to check if everything is going according to that plan or not, and verify, okay, that everything that is listed in the plan, it is accordingly, and you should have a rationale as well. Okay, and under the food safety plan, you have risk assessment, written policies and procedures, as well as records. Records will be maintained on a daily basis. Written policies and procedures are to be followed on a daily basis, and if at all there is any hiccup in the food safety in the daily working phase, you have to refer to the policies and procedures, see what the procedures are saying when there is a problem, and accordingly what is mentioned in the guidelines, you have to put it into practice. So that's about the food safety program and services. If you have any